through the hole, what will happen? There will be leakage of the fluid or leakage of the gas. So gas, if it is all leakage, means it will be in the peritoneum of the abdomen. Abdomen is covered with the peritoneum cavity. Okay. So in a thorax, it is covered with the pleural. Lungs and all is covered with the pleural. So same thing, their pleural cavity, here peritoneal cavity. So it won't go out from the peritoneal cavity. That's why it will not enter to the thorax. It will be there in the abdomen somewhere only. So that is to see. So intestinal obstruction, the blockage of the intestine. So that is usually supine AP is enough. Sometimes if it is required, we can go with the erect abdomen. Any abscess, fluid cavity due to any infection or the abscess, usually liver, spleen, all those things and all. So if it is there supine AP, any tumor is there, means we will go for the supine AP radiography. And any related to hepatobiliary system, related to the liver, anything it is there, means if a liver calcification is there, means we will go supine AP, we are able to make out. If it is calcification is there, means a dense radio opaque material, so easily we can make out in the radiography. Then gallstone, that is also LAO RPO, because gallbladder will be situated obliquely in the liver, in the inside of the not in the below the part of the liver of the right lobe. So obliquely it will form. That's why we need to take a LAO or RPO, left anterior oblique, right posterior oblique. So any one view. So intrahepatic abscess, any abscess is there, or previously slide also I mentioned abscess is there, means we'll go for supine AP. Any biliary tree calcification is also there, means supine AP is enough. Gallbladder, I already told gallbladder is there, means LAO or RIO, that is also can be go. The same time, what are the preparation is required when it comes to the abdomen radiography? If it is patient, when it comes to the abdomen radiography, straight away we cannot take unless emergency. Any acute abdomen suspected is there, means we should not go for fasting or a patient preparation or giving any drugs to clear the bowel and all, because when is suspected such cases, acute abdomen and all, if you do this all preparation, there is chances of complete obstruction of the bowel. It will block. That's why. So what are the preparation is required? Pre-preparation before patient comes. I mean, always, usually when abdomen radiography is there, KUP, this all radiography, the patient should take appointment. It means previous day they have to go undergo certain medication and all. So one is, you can see patient should have low residue diet, low in the sense low fiber material should be should be eaten. Try to avoid high fiber material, so that high fibered food, so that if it is eaten such thing and all, it will take a long time to get digested. So it will be there in the stomach, or it will be there in the intestine. When you take a radiography, there is chances of obstructing the indications. Then should patient undergo laxatives, usually Dulcolax and Gasex will be given to tablet previous day night, so that all the fecal matter, everything will be cleared out in through the bowel. So clearly it will be seen. So as I already mentioned, emergency if there, no preparation required. That is one. Then 28-day rule always be observed if it is female patient. I think all of you know about 28-day rule. So that is one of this thing should be known. What are the main factors affecting the positioning and surface marking of the organ? See, taking always, I used to tell you people, radiography can be taken anyone, not a problem at all. If they trained one person for 1 week, able to take it, but the person should know why. The technologist must know why we taking this radiography, what is the indication of it, why it is required, all those things and all. So what are the main factors when you take abdomen radiography? You sometime 17-14 cassette is enough, sometime 14 into 14, sometime 12 into 10 pediatric patient individual. So this all vary, it will be not constant, even factors KVP vary, MAS vary. So those are all different factors what I'm going to tell here. One is body build. I told male different body habit, female is different, so always you should think of that, and you should accordingly you have to plan it the procedure. And another one is pace of respiration. See, some patient will able to understand what you say, he will hold for a longer time. Sometimes some patients will come with a severe pain is there, can you ask the patient to hold for a 10 second? No, it is not possible. So you have to plan accordingly. If it is such patients is there where patient not able to hold on for even for the 5 second or 3 second, you have to plan accordingly and you should take the radiography. Then next to the posture, erect or recumbent. Usually supine is not a problem, patient will be lying down, easily you can plan it. But sometimes erect abdomen is very difficult, patient not able to stand, all those things. So always you should have asked with the, by seeing the patient only you able to understand, is it okay, we erect can be taken, or if it is not possible erect means you can go with the recumbent. Recumbent in the sense you can take it with the sitting positioning, you can take. So these are all options you should be plan. Loss of tone of abdominal muscles which may occur with the age. That's what I mentioned. See, when a younger patient, well-built patient comes means you need to give more factors, KUP, MAS, technical factors you have to take. Sometimes if patient comes with a little aged patient means the factors also you should think about it. The body structure will be different first of all. Then landmarks will vary. See, bone will be usually in the same place, but in some aged patient, 60-70 years patient comes means usually they'll patient will be having colossus or their bony structure will be different than the normal one. So you have to see that and you should plan it. So change of the, that's what, change of the size due to pathology. Patient sometime if we take example, any obstruction is there, patient stomach will be huge, it will be extended. So that time umbilical level will be different than the normal patient. Breathing time when taken a breathe, that time also the phase of the movement of the abdomen also will be vary. Those things and all you should think and you should take. So that is what quantity of the constant of hollow viscera, that is also different. In the sense the body of the abdomen part of the abdomen will be a vary due to the patient age, might be gender, all those things and all. Sometimes the presence of the abdominal mass, if it is huge mass is there means example, if it is the mass lesion is there in the right kidney, so what it will do, it will push up the liver from the normal area, it will push the abdominal aorta, it will push the left kidney if it is big mass lesion is there. So you have to think all those things and all. So that then normal variant within the population, that's what normal variant within the population means. Indian body habits is different, European body habits is different. When the patient comes with the European body, usually African people, all those things and all, they are very taller. 17-14 cassette also sometimes not enough to include the abdomen. So such countries and all will have 17 into 17 cassette. So depends on that, you should be able to take. In India, usually maximum say 17 into 14 is enough. So that is what this all included in the part of the abdomen. So till now I explained about quadrants, regions, that landmarks very important, and I gave some gave an assignment also. You have to clear, you have to send that assignment. Then you learned about indications, what are different indications and all. and what is the preparation of it, and what are the main factors affecting in this radiography. So in the next class I'll talk about positioning, how you take supine view, how you should take erect, how you should take about decubitus view. All those things will be explained in the next classes.